Moving on, let's shift our focus to the COVID crisis in the country. India has recorded 41,831 COVID cases in the last 24 hours and also 541 people succumbed to COVID virus in the span of one day. With this, the country has logged over 40,000 daily cases for the fifth consecutive day. Remember, Centre has identified and issued warning to 10 states which have positivity rate above 10%. In fact, these include Kerala, Karnataka, Tamil Nadu, Maharashtra, Mizoram, Meghalaya, Odisha, Assam, Andhra Pradesh and also northeastern state of Manipur. In fact, meanwhile, states neighboring Kerala, that is Karnataka, Tamil Nadu, have tightened COVID curbs at the state borders to arrest the spike. In fact, let's get you some details coming in from the hotspot state of Kerala right now. Kerala has logged more than 20,000 fresh COVID cases for the fifth consecutive day. Kerala government has warned that the second wave is still here and more than half the population is still vulnerable to the virus. In fact, the state health minister has urged people to avoid crowding during Onam celebrations to reduce the risk of getting infected. Remember, Kerala government faced massive flack for easing curbs during Bakrid.
A six-member team of the NCDC from New Delhi is visiting Kerala, and the visit is underway right now, where they will be holding talks with the various district medical officers and health officials on the ground. They've been divided into two teams, one looking after the South Kerala districts and the other looking after the North Kerala districts. Remember, for the last 5 days, the COVID numbers have been crossing the 20,000 mark with a test positivity rate of 13.3 if you look at the last 5 days, and if you look at the last 2 months, the cases has been increasing from 13,000 to 14,000, and it has now crossed the 20,000 mark, which has become a major concern. Yesterday, the NCDC director whom we spoke to said that the biggest challenge in front of the health officials to ensure that the TPR is below 5. Anything above 10 is a dangerous mark, and also the R value, the effective reproduction rate, here as far as Kerala is concerned is 1.22. In Malappuram it's 1.37. Now all these things clearly show that the number of cases and especially the COVID management strategy has failed somewhat. One of the other reasons which has been stated is the unscientific strategy that's been imposed on the ground by the government, especially the health department has imposed this lockdown, where for 3 days you have a stringent lockdown, and for the rest 3 days including Monday, Wednesday and Friday, your people are allowed to go around and shops are allowed to open. That could lead to overcrowding and hence spreading of the infection. The government has been introduced a TPR based management on the ground, which is clearly not working, and hence the government has decided to identify COVID clusters and then segregate them into micro containment zones, and to ensure that those people who are having symptoms will be moved to the nearby FLCTs and other centers, to ensure that those people who are having symptoms will be moved away from those people who doesn't show symptoms. So this was the strategy imposed during the first wave. Now the government is going back to its roots, going back to its basics, and in the next 3 weeks is going to be extremely crucial as far as COVID spread in Kerala is concerned.
While the state of Kerala is battling a massive COVID spike currently, several other southern states are also taking precautionary measures. And one of them is, of course, Tamil Nadu. Amid rising COVID cases in the state, negative COVID test reports have been made mandatory for people who are coming in from Kerala to Tamil Nadu. In fact, this new rule will be effective from August 5. Chennai has also decided to shut down 9 major markets amid the fresh spike that the state is witnessing. Meanwhile, important temples have been ordered to stay shut in Chennai, Trichy and Coimbatore in view of the auspicious month of Adi. Remember, Tamil Nadu has reported nearly 2,000 new cases in the last 24 hours.
பகுதியிலிருந்து வருபவர்களை RT-PCR பரிசோதனை அவசியம் என்கின்ற அறிவுறுத்தலை சொல்லியிருக்கிறார்கள். அந்த வகையில் கேரளாவிலிருந்து தமிழகத்திற்கு வருபவர்கள் RT-PCR நுழைவாயில்களில் RT-PCR பரிசோதனை செய்ய வேண்டும் என்று அறிவுறுத்தியிருக்கிறோம். அது அல்லாமல் ஏற்கனவே 2 தடுப்பூசிகளை போட்டவர்களாக இருந்தால் ஒரு 14 நாட்களுக்கு பிறகு வருபவர்கள் அதற்கான ஆதாரங்களை சமர்ப்பித்துவிட்டு வரலாம் என்றும் சொல்லியிருக்கிறோம்.
In fact, to give more details on this, in fact, Times Network also spoke to Chennai Civic Body Chief on the current situation which is prevailing in the capital city and the state, of course, and what are the steps that are being taken by the administration. Listen in.
After a span of several days, Chennai is seeing a marginal spike yet again. What is the situation right now on ground? There are several people saying this could be the beginning of the third wave. Is there a cause of concern at this point?
Yeah, actually, the number of positive patients, daily positive patients, was about 7,500 plus in May, 12th May. So it came down to around 123 about a week back. But in the last 2-3 days, it has slightly risen. It was 215 day before yesterday, 204 yesterday. Though it's a small rise, but we are not taking it easily. We want that the corporation and the city police should take all the steps necessary in order to ensure that whatever are the sources, they have to be isolated, and maximum strict COVID protocol has to be followed in order to ensure that this rise gets curbed. This can be a small rise here and there, but we are not taking it lightly. So we are taking all possible steps to stop its spread.
So you've already ordered that some of the major markets in the city will be shut down for 10 days so that, the crowd can be controlled. Are we expecting more restrictions to come into place?
Yeah, actually what we will do is, based on these restrictions, and the corporation officials are also actually now further strictly enforcing even the fines and other, because a lot of people we see they are not very particular about putting up masks. So we are enforcing our restrictions, and we will watch the progress of COVID and how it's how many patients are being positive every day in the coming days.
Well, that's right. In fact, Tamil Nadu Health Minister Ma Subramaniam has said that it will be made mandatory for people coming in from Kerala to Tamil Nadu to produce an RT-PCR negative certificate or the vaccination certificate. So if at all a person who's coming from Kerala wants to produce the RT-PCR negative certificate, the test should be taken at least 72 hours prior to the date of travel. And if at all the person is showing the double vaccination certificate, then the person should have received both doses of vaccine at least 14 days prior to the date of travel. So this is the guideline that has been issued by Tamil Nadu Health Minister Ma Subramaniam, and this will come into effect from August 5th. Is what he said. Now, this is of course being done to make sure that there is no spike in COVID cases, because Kerala has been reporting around 20,000 cases of COVID on a daily basis, and several other states too have put in these measures. For example, Karnataka has also made it mandatory for passengers coming in from Kerala to produce a RT-PCR negative certificate. So similar measures are being adopted in Tamil Nadu as well, and as far as the state government is concerned, strict instructions have been given to district administrations to make sure that proper containment measures are taken, because in the last few days Tamil Nadu has been recording a marginal spike in the COVID cases, and they do not want to take any chance, and they do not want it to go out of control once again. So for that reason, already we are seeing restrictions being imposed. Major market areas in Chennai have been shut down by the Chennai Corporation. Similarly, even some of the important temples have been shut down.
And now let's get you some details coming in as far as travel restrictions are concerned in the state of Karnataka. In fact, a major focus has been given on travelers coming in from Kerala as well as Maharashtra. For them, RT-PCR test reports have been made mandatory for entering the state of Karnataka, and all bus services to Kerala's Kasaragod district have also been suspended. Meanwhile, the COVID guidelines imposed till August 2 have been extended till August 15. Remember, Karnataka has recorded nearly 2,000 cases in the last 24 hours.